My name is Dr. Brian Ouellette with Scoliosis Specialists of Georgia. Today we're going to talk about early onset scoliosis, EOS. So there's many different types of scoliosis. We have juvenile scoliosis, adolescent idiopathic scoliosis. We treat adult scoliosis. We have postural scoliosis, all different types of scoliosis. Today, we want to talk about EOS, that early onset scoliosis, because probably the most dangerous, because it can create something called TIS, which is thoracic insufficiency syndrome, which is a lung problem. And so early onset scoliosis is anyone under 10 years old. The importance of this is from 0 to 5 years old, the spine will grow 10 centimeters. That's 2 centimeters a year. That's rapid growth. Scoliosis gets worse with growth. So if we have somebody under 10 and we know from 0 to 5 it's growing 10 centimeters, from 5 to 10 the spine's growing 5 centimeters, which is an average of about 1 centimeter a year, in this time frame, the scoliosis can get really bad, right? So the younger the child, the higher the risk that the spinal deformity will affect pulmonary function. So this can create a big problem as an adolescent, or it can be a huge problem as an adult. So if we look here, there were some autopsies done on children who died from EOS. And these children that died from EOS, they found vascular remodeling in the lung, which caused that pulmonary hypertension, which creates death. So we want to stay away from this TIS, thoracic insufficiency syndrome, and we need to treat the spine early. So a lot of you will go to your orthopedic, and they'll be so young that we'll do that wait and see approach. We don't want to do that wait and see approach. It's too risky. It's too risky for your child. So there was a Swedish study. It showed that 2 times the mortality rate by the age of 40 when comparing to the general population, right? So all this information that I'm giving you right now is not my opinion. It's out of the pediatric journal. So these journals are on our website, and you can read all the research and the studies done. We recommend that you do, because this is so important. If you get a child that's under 10 that's been diagnosed with scoliosis, we need treatment. We need treatment fast. It doesn't matter what the degree of the curve is. It could be 10, 15 degrees. We can correct it at that time. Don't let this get into a bigger problem. Here's a 5-year-old with a 37-degree curve. That's going to be a huge problem as an adult. They get treatment too late. That can be dangerous. So what kind of treatments do we want? Well, at that point, is your child in a rigid brace, a hard brace, a body cast, 22 hours a day? Some are in body cast 24 hours a day. Well, that does the same thing. It actually creates thoracic insufficiency syndrome because it encases the spine. It doesn't allow the rib cage to grow. It doesn't allow the lungs to grow. And we end up with the same problem. I recommend you go to our website, www.scoliosisfix.com, and I want you to read about one of our braces. It's called the Spine Core brace. It's a dynamic brace. It treats the spine. The earlier we get it, we may be able to correct it, but it treats the spine. It allows the patient and the child to wear the brace underneath the clothing and be active. It's a dynamic brace. It allows for growth. So it doesn't inhibit any growth in the spine, the rib cage, or the lung. So again, go to our website, scoliosisfix.com. There's phone numbers. We'd be happy to do a phone consultation free of charge. So if your child has this or any type of scoliosis and you'd like a free consultation, just give us a call. The number's at the bottom of the website, maybe even at the top of the website. Give us a call. We'd love to help.